Well, hello again. Welcome to week 5 and questioning normality and escaping from failure is the title of this week's narrative layer. Um, as I mentioned at the very first week of this course, each week we're adding a new layer or a new, additional perspective on a layer that you've already examined. This week, I'm really I like how Denborough takes a very different perspective on serious mental illness and talking about it in terms of normality. Who's normal, right? And who decides what's normal, and how do cultural considerations, here factor into that. In some Native American cultures, for example, hallucinating, even with the assistance of hallucinogens like different forms of peyote, and then having hallucinations and visions is considered intensely spiritual. And then you contrast that with mainstream, American culture, where people might be quick to diagnose and label hallucinations, regardless of setting or context, as a serious mental health issue. That's just one small example. There's certainly many others, and I'm sure many that you can think of, where normality, it's the definition of normality changes depending on where you are and who's in charge and who's setting the criteria and the expectations for any given part of society. So I hope you enjoy that perspective this week. I think it's a very freeing and strengths-based, unconditional regard sort of perspective for social workers to subscribe to and to hold and bring to our relationships. What we'll also see are some other considerations and ways that narrative can help not only normalize, but help people to really, again, reconstruct their interpretation of whatever their own particular issues and struggles have been, even with something as significant as somebody who's been diagnosed with paranoid schizophrenia. And there's a video that it's one of my favorite videos of a therapist who the title of the video is "Inviting Paranoia to the Table," and it's one of my favorite videos by Amanda Warhol, where Amanda will talk to us about this relationship that she's had, this journey that she's had with this woman who was previously essentially completely debilitated by her schizophrenic symptoms and the ways that her providers had been working with her prior to her introduction to narrative. And I just think it's a beautiful story. I really encourage you to listen to it. It's only a half an hour. Again, like some of these special moments, pick a time when you can just kind of savor it, really listen to it. Maybe you're driving the car, you're able to pop it in through your all of your electronic connections. I don't want you, obviously don't want you on a tablet or a phone while you're driving. But if you can do that, Yeah, through your car, great. But whatever your quiet time is, and really sit with that. I think the other really fascinating video this week is by it's on by Christina Lanson, and it's on a narrative approach to people who express concern about eating in their bodies, and even the title you can see is a more strengths open, inclusive kind of title rather than labeling somebody as having an eating disorder or anorexia or bulimia or something to that nature. So yeah, just kind of sit with that, right? It's the collective experiences of women who express concern about eating in their bodies. I love that. So if you have a chance to really look at those, I hope you enjoyed the videos last week. I'm sure your instructor is enjoying looking at those, and you'll certainly hear back from us on those in the near future. So what else do we have this week? We have the discussion board. You'll have it's trying something a little different here. I wanted you to imagine that you're an ambassador for narrative therapy, and you're going to go to a clinical training, a clinical symposium. You've been invited to talk about narrative and serious mental health issues. And there's quite a bit of skepticism among your colleagues. People are questioning and challenging whether narrative is a strong enough, disciplined enough, structured enough approach. And your job is to go in there and talk about that. So I hope you enjoy that. We should have some fun with that. You have a significant reflective reading journal this week from the Burek-Weiss book. We're going to catch up and have you reflect on the readings you did last week and the readings you're doing this week. And I hope you're enjoying that book. I just find it to be just a really beautiful and inspiring perspective that really gives a different sort of a more arts and social justice viewpoint than to complement what we get from David Denborough in his book. So that's where we are. Yeah, enjoy it. Enjoy week 5, and I will see you again next week. Take care.